Hello, my name is Joy Ashby Cornthwaite, and I will be your host for this episode of the live stream show, MyDiabetesHQ Live. This weekly broadcast is developed and produced by Cities Changing Diabetes volunteers from here in Houston and in Philadelphia, our sister city, which recently joined the global network of 25 cities working to improve diabetes prevention, care, and management. You can learn more about Cities Changing Diabetes by going to citieschangingdiabetes.org. The purpose of this effort is to help people living with diabetes and their caregivers successfully transition through these very challenging times of COVID-19. Each Saturday, we gather diabetes care experts to discuss and to share their incredible knowledge about diabetes. They have years of experience in self-care, medical care, public health, community health, and advocacy, and will bring this knowledge straight to your waiting eyes and ears. We hope that these conversations will give you the tools to build skills, to manage diabetes, and to live your best lives, not only surviving, but thriving and doing all the things you want to be doing. Today's episode is coming up right now. You don't want to miss this. Hi, everyone. Remember that the content shared during the MyDiabetesHQ live broadcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding diabetes or any medical condition. So hello and good morning to all diabetes warriors, champions, and advocates. Welcome to the 14th episode of MyDiabetesHQ Live. We are joined on our MyDiabetesHQ Facebook pages and MyDiabetes YouTube channel. Thank you and welcome to our show. We're happy to have you here with us. So coping with diabetes is a full-time job outside of a pandemic. We know that every day, people living with diabetes are dodging difficulties created by either their environment or managing their diabetes. Our guests today will share their personal experiences and special considerations when living with diabetes and navigating interactions and relationships with others, especially now during this pandemic. Their stories will drive the conversation towards lessons learned and safeguarding diabetes management that extend beyond our current times. Tell us where you're watching from and join me and Marianne Strobel. Good morning, Marianne.
Morning.
Marianne is a registered nurse and fellow certified diabetes care and education specialist. And Serena Valentine. Hi,
good morning.
Serena. She is our leader and CEO of Core Initiatives. We're welcoming Dr. AJ Rao.
Good morning.
Hi, Dr. Rao.
Hi.
Coming in from Philadelphia, Associate Professor of Endocrinology at Temple University. And we have Reva Verma, CEO.
Good morning.
Hi, good morning. CEO of Reneka App Builders. And rounding out our team today, we have Christine Mompoint. Hi, Christine.
Good morning.
Christine is a person living with diabetes as well as a really excited advocate for individuals who are also living with diabetes. So good morning, everyone.
Good morning. Can't believe it's September, but it is.
I know. I wonder how we got here. Yeah, just a little while ago it was March, and now we fast forwarded pretty quickly through all of this. So this morning, what we want to focus on is kind of thinking about, we have been seeing each other online for months and months now, and people are beginning to go, out into the community, and people have been working in the community throughout this pandemic. I know that Christine and Reva have experienced especially some trials during this this time with relationship to or with regards to relationships. Do you guys want to start us off, and then Dr. Rao can help us kind of navigate through those situations?
Sure, I can go first.
Excellent. Thank you.
So during this pandemic, we've obviously had to shift to working from home and figuring out, what's safe, not safe, what levels of risk are we willing to take. So with regards to relationships, I live in a house with 3 other people, and that meant that we all had to take into consideration what was important to each person in that living situation. So, as me being a type 1, I knew that I was at higher risk. So, for the first few months, we didn't know how long or the impacts of COVID-19. So, I moved out of my house for a few months and moved back in with my parents just to kind of wait it out and see, what the risks were going to be. But after, and we as a group, as a family decided, we were going to be pretty low risk. We were going to stay in level risk 1 area according to the CDC guidelines. So that meant we were not going out. We were barely doing takeout. We were wearing our masks if we had to speak to people who were coming over to the house, that sort of stuff. But that impacted, my diabetes care, because I had to make sure, it was reiterated many, many times, make sure that your blood sugar is in control, because you want to be as healthy as possible if you do get exposed and get sick. So that was kind of another level of stress, because as a diabetic, we continuously have a million decisions to make every day. And to add this added stress of the unknown, I felt personally it was like very mentally taxing. So I did take a break and I drove up to Denver. And when I came back from Denver, I decided to live back in my house with my roommates, and that kind of turned into the ultimate stressor, because 2 days later, one of my roommates tested positive for COVID. Then we all had to get tested and leave the house. So it was about finding out different types of COVID tests, whether you do the rapid test, whether you do the molecular test, because there were so many false results coming out. So then we were quarantining, and then 5 days later, my second roommate tested positive for COVID, and then a couple days later, my third roommate tested positive for COVID. And somehow during all of this, I did not test positive, which is amazing, but it was so stressful because, like we talked about in the previous episode, we had to, get an emergency preparedness kit together, because I couldn't go back to my parents' house. We have my elderly grandmother who's a breast cancer survivor. We have my dad. We have my mom. So all people in the higher risk category. And me being exposed, it wasn't safe for me to come back to that house. So I was kind of a gypsy for almost a month. I was like floating from place to place, trying to figure out, what the best way to navigate this. So it was obviously extremely stressful, because people want to help, but people don't know how to help in that situation. You don't know what tests to rely on. There's not a lot of information out there. You don't know the long-term effects of this. There's even contradicting guidelines on how and when to quarantine and when to get retested. So, they're like going through this whole list and keeping up with your diabetes to make sure that if you do get it, you're going to conquer it the strongest you can. It was like such a mentally taxing process. So that was my experience so far.
Yeah, so I think that what the experience that you're describing just sounds really, really stressful. And I think that it's something that maybe isn't brought to the forefront enough right now. And I think we should jump over to Dr. Rao and just see what the baseline, protective measures are that a person living with diabetes can have, because can do, because I think we do have a lot of multi-generational households around the country who are living with these exact same considerations, right? People living with diabetes, elderly, parents or grandparents, younger children. Dr. Rao, can you just kind of begin, I know it's a lot, but just begin to kind of outline what should we do if we find ourselves in these situations? Because I think a lot of us will and have.
Yeah, I mean, I think just such a compelling story, Reva. I mean, I think that's so much that you went through, and really is what a lot of our folks around the country are sort of experiencing over the last 6 to 7 months, as to how to approach some of these things that we think are very simple, but they're really quite complex. So I think there's obviously the aspect of prevention, which I think is really important, and we've been trying to, whenever we see patients, we keep on reminding them about some simple measures that you can do to even prevent you from sort of being at risk for getting the virus. But at the same time, for those who are living with diabetes, there's some added measures that we have to keep in target. And Reva did a great job of mentioning, how it was so crucial to try to make sure to keep the glucose ranges, the sugar ranges in good control, if one is to develop the virus. So I mean, I think I try to mention the sort of the 5 simple tips that have been talked about over and over again, but also sort of that added wrinkle of keeping your sugars in range.
Would you like to go over the tips around now, or do you want to?
Sure. Yeah, I think it's maybe a good time. Again, this is more on the prevention aspect as opposed to what to do logistically if somebody around you happens to turn up positive for COVID. So I think the one important thing is wearing masks. I think sometimes we not only forget that the mask wearing is important because we think it all sort of sheds through the air, but also it prevents that issue of us touching our faces constantly, and pushing things onwards that way. We've talked a lot about keeping distances from others, and we talk a little bit about the 6 feet of distance that's depicted in this slide. Washing your hands often. Trying to do that more often than you typically do, I think is really a good point. Also, we've been trying to push as many activities outdoors as we can. I know that can be sometimes difficult as the weather starts getting cooler across certain parts of the United States, but at least during the last couple of months, that's been a lot of fun to do. And I think we take that as something exciting to try to get involved and be novel in the way you approach some of your activities that you think you could do only indoors, but you probably can do a lot of those outdoors. Really avoid places that are full of folks. Some places have opened up bars, as an example, and I think those are places where it's really difficult to maintain social distancing practices, and then I think that's a big challenge. And then added to all of this, for our patients living with diabetes is really trying to continue with good diabetes self-management. And trying to keep your levels in range, not having those sugars go way up, because I think that's remains a challenge to see what happens to you if you were to develop the infection. So I think those are important to keep in mind, these sort of simple tips.
Excellent. So in Reva's case, because we do have, I know family and friends who have individuals who are working, and they are essential workers in medical facilities. And so having people that are coming in and out of the household that are part of your household, and having them perhaps be exposed, and then what kind of, can we go over the steps? Like, could Reva have felt comfortable staying in her apartment with her roommates? Could she have gone home? I know these are kind of like possibilities instead of definites, but are there, could people mask up when visiting, or not visiting, when living in the same household as someone living with diabetes? What should we do if we're forced to do these things?
Yeah, it's a really logistical problem. I think on a day-to-day basis, I even find challenges how I'm approaching my family, and as I go in now back to being in person, which is really important for our health providers to continue to provide care for our patients, but at the same time, sort of balancing that with the folks at home. I think as much as you can. I tried as soon as I arrived back home, I try to go and sort of clean myself, take a shower, sort of take away those clothes that I was using at work, and sort of get into other aspects of my usual care at home. I'm not wearing sort of a mask throughout the evening or the day once I'm home, but I think I just tried to kind of start fresh again and just get rid of the stuff that I wore at work. Ideally, I think the problem becomes when you have somebody who's COVID positive, because we actually had to deal with this recently with a family member moving in with us, and it's just sort of the aspects of trying to keep as much as the social distancing as you can at home, but then you had the sort of the added wrinkle of trying to understand quarantining regulations and et cetera. And I think that's where, Reva did a great job of logistically, it just becomes a big problem. I think the best thing in that scenario is try to, again, separate yourself if you have somebody, again, who's got COVID, positivity. And then, obviously, if anything happens where you're feeling like you're having symptoms of COVID, then it's really important to contact your physician, and again, try to stay away from others is really important.
Excellent. So how many of us having, worked, I work sort of remotely, go in, how many of us, if we have been out, how many of you just kind of like undress on the way into your house? Like, I definitely. So I know that a lot of other clinicians, like the very first thing that everyone does when they go in, and I guess this is part of the prevention, is to like just get everything off before you enter sort of your abode. And then from there, just practice really, really good hygiene practices and hand washing and things like that. I know, Sabrina, you've been working with a lot of individuals through peer support. What are people saying? Is this a concern that they're verbalizing to you as well?
Yes, and they are just really, they're afraid to go out. Most of them, you get some who say, I'm Superman or Superwoman, I can I'm immune to everything and I'll be okay. But then you get the others who are like, I don't want to go anywhere. I don't want anybody coming to my house. I've heard one lady, she's living with diabetes, and her adult children, she hasn't seen them in a very long time, since the beginning of shutdown. And so what they do is they may bring her food or groceries, but they drop it off at the door and they leave. She's like, nobody's coming in my house. So I asked her, I said, so in the middle of doing all of those things, she said she's real careful, wears a mask and all these other things. I said, are you watching your blood sugar? And she said, oh yeah, I'm good. You know, I'm good. I'm okay. I just want to make sure everything outside stays out. And I told her, I said, that's not the only thing that you have to do. You have to make sure that your sugars are regulated, because that's what's really gonna, because what if some little snafu happens and you catch COVID? You know, it's happened to a lot of people. There are a lot of people who have recovered, but it's case specific, and especially for people living with diabetes, it is much better to deal with that when your blood sugars are regulated.
Those are great points. Those are great points. I mean, I think the concept of not forgetting that it's not just all this social distancing, which is important, obviously, but at the same time, you know, if one gets it, making sure your sugar's under good control is an important aspect to maybe not have a sort of a worse outcome, you know, and I think that's such a good thing to remind us.
Yeah.
Mm-hmm.
So now let's flip over to, okay, so we're in our houses, we're thinking about the things that we need to be doing to care for ourselves inside our homes, regulating distancing, regulating seeing individuals, bringing people into the home, materials into the home. What about going to work? I know Christine has some special considerations that, she had voiced to us earlier about, fears and anxiety with going into the workplace.
Oh, thank you all for having me. This is a really great opportunity just to share what's been going on as a college student with type 1 diabetes. And so at first I was a work study student, and then, all the campuses closed. And so then I was thinking to myself, like, do I want to get a job? I'm not really sure. Like, it was very uncomfortable. Like, for a period of time, my parents were able to help me with any kind of like bills or things that I had. But I was like, realistically, I really do need a job. And so I started looking for places of employment, and just hearing with my brother's experience, he's also a type 1 diabetic. His workplace wasn't taking COVID very seriously. They didn't have the plexiglass. They didn't have masks provided or gloves or anything like that. So my mom had actually asked my brother to stop working and to tell his manager that he cannot return to work until that they started, making safety a priority. And so I was like, man, my mom doesn't really want my brother to work. Do I need to get a job? What should I do? And so I started looking for employment in part-time places so that I can go back to school in the fall that may offer health insurance benefits or things to that effect. And so I did end up getting employed for a period of time. And I made it very clear to my employer that I was type 1 diabetic. I needed a job. Anything that could be done to ensure my safety, I really needed to keep at the top of the list. And they provided masks, they provided gloves, they had a very strict sanitation schedule. And then I actually asked my boss if I could work either at the beginning of the day or the end of the day, because that's when the customers were not frequently in the grocery store. So I ended up having like 4 a.m. shifts, and I would get off at 9 when the grocery store opened, or I would work like late evenings. Like as a college student, I have that luxury, but I definitely know that like other people didn't. So like my brother working for like a smaller dollar store, they don't have a ton of employees that have this varied scheduling. So he would work 9-hour shifts. He would work weekends. We work 4 or 5 days in a row. And like every time we come home, my mom specifically asked that we shower immediately. Like I feel like all my clothes are printing because I wash my clothes. It's been a long process of trying to make sure that we're safe and that the people around us understand that safety is important to us as well.
Yeah, and she's probably washing it in the hottest water possible. Yeah. I had one of our really good friends who's also a college student. When the colleges closed down, we dropped her off to the airport so she could go home. And she told us about the very stringent, planning that her mother made. Her mom's a nurse. My mom's a nurse. A lot of moms who are nurses will do these plans. But she actually dropped all of her stuff out at the front door, and she like got dressed into a gown and went straight to her room so her mom could like control things until she's been home for 15 days. So, you know, at the beginning, I think people were being overcautious in our home space, like in our own space. But it's interesting, you know, that you're telling us about the fears that happened at the forefront of the shutdown, right? When no one really knew what to do and employers didn't really know. But Dr. Rao, can you speak on, you know, what the things are that individuals, people living with diabetes should do when they, you know, when they are there ADA measures they should take to safeguard themselves, I think is what Christine.
Yeah, I think inquiring about you know, how Christine approached it, inquiring about what's you know, do you feel safe? Do you feel that you are you know, protected with the job that you're doing? I've actually had a number of patients who have jobs that clearly can be remote, and I've actually tried to assist them with you know, sort of mentioning to their supervisors their need to be remote because of them living with diabetes. And the American Diabetes Association has had some great sort of helpful templated letters that providers can use to help patients in that scenario. But, you know, we recognize that not everybody can be remote, and their jobs can't be made remote. So I think what you know, Christine's approach was crucial, trying to figure out what sort of protective measures that they're doing. Because one of the problems is that sometimes you may hear a company offering some protective measures, but that may not, that's sort of a population-wide approach, right? And with one living with diabetes, there might be some, you know, some certain aspects that you're more interested in hearing about, and you just have to ask for those things. You know, whether it be where to store my insulin pens, you know, will I have the ability to do these things at work, and can I be, you know, shifted to hours where it's not as busy, if possible.
Yeah, that's excellent. And I know that Marianne has been working with disaster preparedness for a very long time. And this is not, you know, an emergent disaster. And it's kind of this long-term thing. We don't even know when it's going to end. But what are some of the tips, Marianne, that you give individuals? Because I know that with working with my patients, I tell them to ask for accommodations, but come with a plan, right? So Christine's plan of, you know, I know the shifts and the customer base, and when customers come in, I'm coming to you with a solution that isn't going to upend your business. What are there some tips that you give your patients, Marianne?
Yes, that's very good. I really liked what Christine said, and you're absolutely right. She came with a solution. So she actually analyzed, you know, the workflow of the business, and then went and not only made a suggestion and an ask about what could be done for her to be more safe with her own workflow, but it also benefited the other employees that were there, because like she said, there was a lot of them that didn't have the luxury to take those hours, and she was available to do that. So it was kind of a win-win for everybody. I think a lot of people don't realize that diabetes is covered by the American with Disabilities Act. And so they do have some protection for these accommodations. But again, that has to do with the individual with diabetes and their comfort level as far as expressing to their employer and disclosing that they are living with diabetes. But as far as preparation, I know one of the challenges that I keep hearing over and over again is that when going to get some insulin, if you get it from the pharmacy directly, that sometimes some of the pharmacies are a little back ordered on some of the different insulin types. So, you know, again, don't wait till the last minute. If you have oral medications or you have insulin that you need and you're going to go pick it up from the pharmacy, as soon as your script is available, you need to go and get that refilled. If a state of emergency is declared in the state where you live, certainly the national emergency with COVID gave some leeway to having some early refills on things like insulin and diabetes medications. So you want to keep a watch on that and just make sure that you're staying as prepared as possible. Don't wait for the last minute is really the takeaway that I would give.
I'm going to pull that up on the screen there. So I wanted to highlight that that living with diabetes is covered under the Americans with Disabilities Act. And so there are accommodations that can be made through your employers in different locations. And then also do not wait till the last minute to pick up your insulins and your medications, any of those things. If they happen to be back ordered, or you just forgot, because that happens. Like sometimes you just forget and you're down to your last dose. If you are on, going to sort of a national chain, even if you're not going to a national chain pharmacy, you can ask them to ask a location near them if they have it in stock, and then just have your ask your pharmacist to transfer your refill for that refill if you're able to.
Yes.
Yeah,
absolutely.
the back ordering has been a big problem, and I think that's great. That's great to ask other pharmacies in the commercial network to see if they can help out. I think the other thing I want to add, just again, I'm a provider too, so I'm biased about this, but call your provider too, because sometimes they have ways of figuring out maybe for one, and this is why it's so important to do this in advance, as Marianne was mentioning, because then we can figure this out, whether it be another brand to bridge you until the brand that you're looking for comes in, or if there's some other treatment that you can get while you're waiting. These can all be worked out if you do this in advance, as opposed to right when you're in desperate need of fills. Sometimes we have samples in the office to help people through these periods, but I think that's really important too, to keep your providers in play if the pharmacy can't help you.
Yeah.
Dr. Brown,
go ahead.
A really important point there about calling your provider, because one of the barriers, beside knowing that you can get your early refill or get your medication refilled, but some people will tell us that they have challenges monetarily if they have a copay that they have to pay, or maybe they're paying completely out of pocket. So Dr. Rao, you're absolutely right. You also need to call your provider as soon as possible and have your provider help you problem solve, because your provider may have additional resource information to help you out. So that's another really great point.
Yeah. And I think this overlays into both Christine and Reva's stories today, because accessing medication can be difficult either, because of insurance, but it can also be difficult because Reva had to move to different places where she's living. Yeah. So if you have your medication stored at one location and you have to evacuate and move to another location, it may, living in our big cities like Philadelphia and Houston, an 11-mile drive can be an hour and a half to 2 hours.
Yeah.
And so, you're fearful and you're anxious and you're thinking, I really need to figure out how to protect myself from COVID-19. My roommates have been diagnosed, and you up and you grab everything and you leave your apartment, but maybe your supplies are at your apartment, So those are, I think that, to Dr. Rao's point of calling your provider, your doctor's office, your support staff. If you're using things like insulin pumps, you can call your pump representatives. They can often, meet you somewhere and bring you supplies, or we won't go into that. We'll just, we make it work. People living and advocating for diabetes knows what happens sometimes in parking lots. So exchanges of supplies, trying to help each other out. So we won't. We'll just stop there. Anyone else want to keep going? Raven, talking about.
That's a story for another day.
Different story for another day. So, Serena, you're working directly with so many of our peer support members here in Houston. Are they experiencing access issues like this?
Lately, not so much. I know at the beginning of the shutdown, yes, even I was experiencing issues with getting my medication at the beginning. I guess because then, you know, right when something happens is then everybody's like, oh my God, I need to get my medicine. I need to get it. So everybody's doing it at the same time. Everybody's got the same idea. So then, yeah, there's a big rush of everybody at the pharmacies. And so at the beginning, I did just like so many others did, and I was hearing it a lot in peer support. But now, I think because that has happened so many, you know, well, not that long ago, but to me, it felt like ages. But because that happened at that time, a lot of people have, you know, kind of sparked up and been like, okay, from now on, I'm going to do this. And so everybody that I'm hearing is kind of following suit with making sure that they have the medications that they need ahead of time.
Mm-hmm. Exactly. I think that we will on that, the conversation about resource management is one that can house its own separate hours, 2 hours, 3 hours. But I guess to come back to our conversation here today, there are advocates everywhere who know how to help you. Okay, if they don't know, they know somebody who will know, who will know, who will know. And so the diabetes community and the advocacy that community members are completely dedicated to, you know, we're here to help one another. And so I think that if our community really holds us together and makes sure that each of us is able to thrive. So please reach out. Okay.
I think that's one reason why Serena's group is so important, because I also hear from people that sometimes they're a little, you know, shy or hesitant in reaching out. And sometimes with a peer group, the people are more apt to, you know, ask for that information. Sometimes they're just a little hesitant to bring it forward to other healthcare providers. So, you know, definitely finding yourself in a peer support type of a group can be very, very helpful, you know, and a good place to start to ask some of those questions.
Mm-hmm.
Oh yeah, and if you come to my group, I'm going to get it out of you, one way or the other.
I was just
going to talk about it. Everyone, if you would like to be a part of the Diabetes Peer Support Network, we are on Facebook. If you go to the search at the search bar at the top, type in Houston Diabetes Peer Support Program, inquire, and you know, try to click on the member request, and one of our admins will let you in.
Excellent. Shameless plug. You forgot that.
Shameless plug. Yes.
No, I love that, you know, these networks exist. And I think that if you don't already have one, I know that the Houston Diabetes Peer Support program on Facebook is just fantastic. They will, you know, talking to other people. And I think that this, you know, people living with diabetes can attest to this. And certainly, you know, Marianne, as a mom of a child who's living with diabetes, you know that sometimes the best place to begin your journey or your questions and get things answered starts with others, starts with peers. Because many people have gone through it before. I know that a lot of the things I learned about access and resources comes from, you know, my own personal experience with family members who needed supplies. So
Yeah. And like you said, Joy, it's if you don't know exactly where that supply is or who can help, somebody who knows somebody who knows somebody, because it's actually a very, very small world in diabetes once you reach out. But it's making that first step in reaching out that can sometimes be kind of scary to share, what you're really going through. Sometimes you feel like you're all alone, and you're certainly not. But, that has to come from within, that you have to make that decision to share.
Yeah. And I think Reva and Christine, you guys can jump in and talk about this a little bit more, because I think I grew up, knowing about diabetes. And so for me to transition to, my kids know that I am a certified diabetes educator. And so if they meet another child in school who is living with diabetes, they know how to ask questions, to care, to know that they may need a little extra assistance. You all are younger and you've lived through this. How challenging can it be for other young people to realize that, these are concerns for you all? Because, a lot of times people are like, you're young, you don't have any concerns, you just kind of live it. You live your best life. How do you all interact with, with other people who maybe don't think it's that big of a deal?
Yeah, honestly, those types of conversations can be challenging and frustrating at the same time. But I think with age and maturity, I've learned how to navigate those conversations. So the best way to do it is through education. You'd be like, diabetes is the leading cause of these complications. Like, I could go blind, I could lose my feet, I could, have a stroke or a heart problem. And if you provide numbers and facts and invite people to advocacy events, people are more inclined to be an advocate for you. So that's been the approach that I've taken in order to bring people along with me and feel like, and help make them feel like they're part of the solution versus just, playing the victim and saying, well, you just don't understand.
That's excellent advice. I love that. The best way to educate people around you is to invite them to become an advocate for you. That's beautiful. It's amazing. Christine?
I think for me, because I've been uninsured for a long period of time, living with diabetes, everybody in my circle knows that this is important to me. Like, I'll go out to eat with friends and they're like, wait, can you eat that? Like, what should I do? Like, they're always asking me questions. And I'm very fortunate that I do have people who care. People have, since the pandemic said, hey, how are you managing it now? They're asking me questions. As a political science major, all I do is share stuff about healthcare advocacy. So I think it's just because of the network that I'm in that everybody around me takes it seriously. So I definitely agree with Reva that, if you are educating people, if you're informing people about what's going on and they care about you, then they will come into that circle as well. I think one thing that I've talked about a lot in these last several months is how prescription drug prices are just really insane when you don't have insurance. And that's what everybody in my Facebook groups and things are talking about. Is like, oh my gosh, Christine, like the pandemic is here. Are there assistance programs? Has this gotten better? And I think this goes back to everything that everyone shared today about finding those peer support groups. And I thank you guys for bringing me into yours where, you guys have helped me find patient assistance programs or coupon cards. But I think it's all about who you surround yourself with. Not to say you shouldn't surround yourself with people who don't care, but I think it's like how you present the information to those people that make it.
Yeah, for sure. And go ahead, Marianne.
I just wanted to say one thing, and of course they're not being held the way that they were in the past, is diabetes camps for kids. So I don't know how many viewers we have out there that, are dealing, raising children with diabetes and the value of camps for kids. So, if you're watching out there today and you have a youngster, with diabetes, and after we get through this pandemic and things come back to normal again, just look out for those diabetes camps. They can be great for the family as well as for the child living with diabetes. And even now, still check into it because, there can still be some camps that will be coming up that may be virtual and other opportunities for children with diabetes. So just wanted to address the pediatric population here a little bit today.
Yeah. And peer support is sort of like adult camp.
Yeah.
So that you can share your experiences and all of, as the book says, bright spots and landmines. And so those are really, really important to see, not just the things that we talk about, the tips and education and guidance that we talk to you about as clinicians, but to actually see these things in action. And I'm sure, Dr. Rao, you can speak to how sometimes, saying something to someone, and it's just part of the learning process, right? Hearing something and having it written down and told to you is very, very different than experiencing it.
Yeah, I think that this group aspect and peer support is so crucial. I learn a lot from my patients day to day, and new ways to approach things from some of their own personal experiences, and more importantly, how they've learned things, sort of networking others who are living with diabetes. So I think this is an important part of living with diabetes, because it's a 365 days a week, 24 hours a day thing, and we're not there with you minute by minute, and you're on your own, but you have a lot of help that can be available to you. I think the one other comment I wanted to make is, peer support, although may not be helpful for the children who are living with diabetes, can be really helpful for the parents who are living with diabetes, because sometimes it's hard for them to go through this, day by day, and sometimes networking with other parents on an adult peer support group, but sort of more geared towards care of children with diabetes, can be really helpful for them.
Yeah, so you're thinking like a peer support for the support staff.
That's right. Yeah, right. That's also important. Correct. Yeah, yeah. And the parents are the crucial support staff, right? And that's especially for the children living with diabetes. So of course, yeah, I think everybody needs peer support. I mean, even for physicians, we have peer support going through what's been happening recently with COVID. So this is really important in all entities, so and I think I'm happy there's a lot more attention being drawn to this during this time, because I think speaking it out, talking to others, it just makes it a lot more sort of palpable and something that you can conquer.
Right. And not only does it help you with helping, other people, but when you talk about what you're dealing with, it holds you accountable, because I can't have peer support and tell people, okay, you need to watch your sugars, you need to watch what you're eating, try to go out and exercise. And then somebody asks me, so when's the last time you exercised?
Right, exactly.
We're not talking about me, we're talking about you. It holds me accountable in so many ways to make sure that I take care of my own diabetes, to make sure that I eat right. Sometimes when I'm sitting thinking, I'm looking at stuff and I'm like, I really want this, but then, man, I got peer support this week, and I don't want to have to tell these people that I'm not feeling good because I did wrong. So, it's the whole, y'all are holding me accountable while I hold you accountable. And as we share experiences, it just becomes a whole learning atmosphere of greatness. Oof, greatness. Yeah.
It's like that old adage, like do as I do, or not as I do, rather. And so, as a clinician too, my patients ask all the time. It holds me accountable as well, for sure. So, thinking about, thinking more about relationships and how to support each other. I think we just touched on it just now, just briefly, about the caregivers. we have spoken about it before on a previous broadcast, but also thinking about, you know, the anxiety and the fears that that caregivers are feeling, right? So as someone who may be taking care of a mother or a child, having them find ways to feel supported, to protect their loved one from this horrible disease, right? So I think all of these tips can be applied to caregivers as well, right? Keeping,
Yes.
you know, doing the best that you can and keeping hygiene, cleaning the home, washing your hands, masking up if you're going out. And then also just finding the support that you need so that your health is protected. Because living in sort of the constant state of alert that I feel like we've all been in this past 6 to 7 months here, we've been on high alert constantly. That's a lot of sort of micro trauma to the body.
And it doesn't go away. It's constant. And I know I hear this among the nurses because I work in a hospital situation. And so once in a while, I will wander into the little break room on the unit where my office is. And I'll hear the nurses talking and they're sharing exactly what you're saying. So many of them have family members with diabetes. Several of them are living with diabetes themselves. And so, you know, putting COVID on top of this, it has really, you know, caused them a lot of stress. Now they're able to at least communicate with each other when they do get together in this break room for a few minutes. And I hear some of the stories they're sharing. I know for one of the nurses, she had a very young baby at home and she needed to work. So she actually had her baby able to stay with her mother in her mother's house and took the baby actually, you know, away from her home there for a while until she saw how all this was going to go down. And so, you know, not only was she thinking about, you know, the baby's safety, but she was also then putting actually more stress on herself because she, you know, she worried that, you know, she wasn't going to be there and that she had given responsibility over to her mom. So people are thinking very creatively on how they are going to handle all of this. So, you know, the navigation can be different for every single person, but, you know, going through things like that, which are kind of really abnormal, puts an extra layer of stress. And so people needing really to reach out and be able to, you know, feel comfortable verbalizing that to other people is so important just so that they can try to work through it. Mm-hmm. So it's a lot of stress, just an awful lot of stress going on.
Yeah, and so to continue from that, you know, Marianne, for all of us who are living in this world, you know, in this current pandemic world, I think that, you know, there are things that we can do to safeguard our health and the health of those around us. But I'm going to throw a question to Christine here. She doesn't know yet. She doesn't know that it's coming up. But since she let us all know that she is a budding policy expert on the show this morning, and we haven't had that lovely thing yet. So let me ask you, what policy changes would make it easier to live with diabetes during COVID-19? And questions for Christine, but I want everyone to kind of like jump in because we're in different aspects of diabetes care.
I think as someone who is not insured, seeing a cap on the out-of-pocket cost for insulin would be life-changing. In some of the internships that I'm a part of, I've been kind of keeping up with legislators that are either running again in November or just, you know, wanting to really talk about what's going on during COVID. And a lot of them have said like, hey, we know healthcare is an issue. We're going to work to fix it. You know, getting emails all the time about different people, like different senators and stuff saying, you know, we need to work on this, we need to work on that. And just to see that they're opening the door for that conversation is great, but definitely want to see that follow through. Because even if someone doesn't have insurance, and you know, like some of those patient assistance cards, you do need an insurance to bill. Having that cap, I think, would really just be game changing as like a first step to see what can be done for like diabetics at this time.
Mm.
And so some of the outreach programs right now have established a cap, but they're only for, the state of emergency. So we really have to, like you said, get out and vote, lobby, and discuss with your with people who represent you, and make sure that this stays in place. It has to stay in place.
Yeah,
there are a couple. I'm so sorry. There are a couple executive orders and like Senate bills that are up about this conversation in our Houston area. So I would encourage people to look those up and then call their representatives and say, "Hi, I'm in support of such and such," just to show that people are following and tracking this conversation.
Yeah. And just before you all pipe in, I just want to say the ADA, so the American Diabetes Association, has a link that you can go to online. You can do your local one or the national one, and you can choose to be an advocate. And once you choose to be an advocate, there are templates for letters that can go out once you put where you live to your representatives near you. And so I would encourage everyone to log on to ADA, self-identify as an advocate, and write those letters. Include stories of your experiences helping someone living with diabetes or living and thriving with diabetes, because your personal story is what's going to drive change. And they want to listen to the constituents. So we have to have a collective voice, no matter, which type of diabetes you're living with. If you're a caregiver or not, click on the advocacy button and send out the letters to your local representatives.
Yeah, you're absolutely right, Joy. And one of the things that when you do that, and it could be through the ADA, American Diabetes Association, Research Foundation, advocacy, you will not only they'll even make it easy for you sometimes. They'll actually send you an email, and they've got pretty much all laid out for you. And it's just a matter of you, read through it, agree if you want to add anything, and clicking the button, and it'll automatically go to, whoever it needs to go to, depending upon. So it can be that easy. It doesn't even have to be hard to do. So again, make a point, Joy. Definitely do that.
You're welcome, Catherine. She says, thank you for that information. I'm not sure that a lot of people know about it. I spoke with Melissa from the ADA here in Houston, and she sent that link right over to me. So I've been able to write several letters to my policymakers that I vote for here in my community. So, and I even got a response from one of the representatives regarding.
I like your comment, Joy, about adding a personal touch to it. So, the template is helpful, but I think at the same time, when I do this, I try to write maybe, have a 1 or 2 sentences of a personal experience. And that I think that goes a long way.
Yeah. And I even told them they could contact me. I'm a little intense.
But also, Joy, to that same effect, if you do personally like talking to your representatives, the American Diabetes Association hosts an event called Call to Congress. So this year, because of the pandemic, we were not able to actually go to DC and talk to our representatives in person, but we were able to do that virtually. So, after the pandemic, if after sending these letters is something you enjoy and you find value in that, then you should apply to go to Call to Congress and be there in person, because when they hear you in person, they feel for you and they want to make a change and they want to make things better. So going in person, I think, is just an extremely valuable experience whenever that is possible in the future.
Christine motivating all of us.
It's great.
I think Christine brought another great point I was just thinking about as I was listening to you all, is that, we should use this period to our advantage, right? The things that we're learning that we can do now, whether it be telehealth, whether it be, advocacy for insulin pricing, it shouldn't just be because it's the pandemic, but these are things that we should emphasize should continue, as Joy was mentioning, even outside of the time of the pandemic. And now we have an ability to display, hey, this is why this is important to do this. And so I think that's really something that we have to advocate for.
For sure. Amazing. I really, I know we're getting close to the end, but if there's anything else that you all want to comment on, we can go over a tiny little bit regarding policy. I know, Marianne, because you work in a hospital system and because you do a lot of the disaster preparedness, are there policies associated there that we should be considering as well? So to help individuals, but also to help, organizations.
So one of them, of course, is the early refills for prescriptions. That does come out, or in this case, the national emergency. President Trump declared that for the entire nation. Certainly, whenever a governor declares for the state, then that will go. So that's part of just like care for people in disasters with the Disabilities Act. So just because you're in a disaster and you go to a situation, know that those are still in place. Whatever accommodation that normally would be in place for you during other times.
Marianne, you're breaking up a little bit.
Sorry.
But what we can do is, I know that you have really great tips, and so we can always post that
Okay.
with regards after the show.
Yes.
Okay. But so with that, I think that the conversation that we've had here has been very important because it touched upon our relationships with the people around us, protecting ourselves, protecting the people around us, and also just making changes that are going to be sustainable for all people living with diabetes, to help them thrive as much as possible. And that we should have it here during pandemic times, and whatever the world may be after. Okay, so I thank you all so much for being here this morning. You always get my mind thinking, and I'm always, I'm like ready to write a letter to Bill again. Sorry, people who've already received one. So thank you all so much, and I look forward to having you back on the show with me one day soon. So once you're part of the family, you get to come back often. So thank you to all of our viewers today. We hope that our conversation has given you ideas for coping that are useful to care for yourself, your family, your coworkers. Being prepared with information can make you resourceful and make coping less stressful and less driven by anxiety. So don't forget to reach out, help out, protect yourself and others. We are always, always very, very grateful for our friends and colleagues who take the time on a Saturday morning to come out and to inspire us. Remember to like this broadcast and subscribe. Use the SurveyMonkey list link listed on both YouTube and Facebook channels to provide feedback on the broadcast and share your ideas on how we can improve. Our next episode will air on Saturday, September 19th, when our panelists and guests will hold another important conversation related to regarding diabetes prevention programs and how it positively impacts diabetes care. Thank you for being part of MyDiabetesHQ Live community. See you next time.